Complications of diabetes. Now, people with diabetes can have quite a number of complications. These can involve the blood vessels, nerves, eyes, brain, heart, kidneys, sexual organs, and the feet. So for this video, we will just classify diabetes into type 1 and type 2 diabetes. So recall that insulin is produced by the pancreas, and one of the functions of insulin is to ensure you have a normal level blood sugar or blood glucose. In type 1 diabetes, the body's own immune system attacks and destroys the insulin producing cells of the pancreas. In type 2 diabetes, the body develops resistance to the effects of insulin. So in other words, it takes more and more insulin to normalize your blood sugar, until there comes a time where you are producing as much insulin as you can, but yet it is not enough to normalize your blood sugar. Now, if you have type 1 or type 2 diabetes and your blood sugar levels are out of control long enough, you are going to begin to develop complications. So properly controlling your blood sugar levels is going to minimize the chances of complications, or when they do develop, they will not be as severe as if you did not control your blood sugar levels. Most of the complications that develop in diabetes is due to blood vessel damage that comes about due to uncontrolled blood glucose levels. Persistently elevated glucose levels cause large and small blood vessels to narrow, which ultimately leads to less blood flow to the tissues. Two mechanisms that can lead to blood vessel narrowing are: when the blood glucose levels are elevated, complex sugar-based compounds form and they are deposited in the walls of the small blood vessels, and this causes them to thicken and leak. Also, elevated blood glucose levels cause the level of fatty substances to rise in the blood. This causes atherosclerosis in the large blood vessels, and this also leads to reduced blood flow. Atherosclerosis can lead to stroke and heart attack. Atherosclerosis is 2 to 4 times more common in diabetics than it is in those without diabetes, and it also tends to occur at a younger age. So, narrowed blood vessels ultimately leads to reduced blood flow to the organs and other tissues, leading to problems or complications. Infections. Diabetics often develop infections in the skin and in the mouth. The elevated blood glucose levels impair your immune system and makes it more difficult to fight off infections. Additionally, the infections can become more severe and can take longer to fight off. One common infection is a yeast infection called candidiasis. The candida yeast normally resides in the mouth, digestive tract, and vagina, and it is usually harmless. But in people with diabetes, there can be an overgrowth, leading to rashes in the mouth and moist areas of the skin. People with diabetes are also more likely to have ulcers and infections of the legs and feet due to poor circulation to the skin. A lot of the times, these wounds can heal slowly or not at all. Non-healing wounds can become infected, which can lead to tissue death or gangrene or bone infection, also known as osteomyelitis. These may result in amputation of the foot or even a part of the leg. Eye complications. Damage to the blood vessels of the eye can lead to diabetic retinopathy, which can ultimately lead to vision loss or blindness. Laser surgery can be used to seal the leaking blood vessels of the eye to prevent damage to the retina. Eye injections can also be used to treat the leaking blood vessels. Diabetics should have eye exams 1 to 2 times per year. It is always better to catch these problems in the early stages. Liver disease. Another complication of diabetes is fatty liver or steatotic liver disease. This is where abnormal fatty deposits collect in the liver. This can progress to cirrhosis, which is even more problematic. Liver cirrhosis is scarring of the liver tissue, which impairs its function. This can lead to permanent liver damage or liver failure. Liver problems can be diagnosed with the use of blood tests, imaging, and/or biopsies if needed. Treatment will involve losing weight, controlling blood sugar, and lowering high cholesterol. Kidney disease, another complication of uncontrolled diabetes. Kidney injury leading to chronic kidney disease, dialysis, or kidney transplant can also result from chronically uncontrolled diabetes. And protein in your urine is an early sign of kidney damage. Nerve damage, another complication. If a single nerve in the neck or lower back becomes affected, the arm or leg may suddenly go weak. If the nerves in the hand, legs, or feet are affected, there may be abnormal sensation. The person may experience tingling, burning pain, and/or weakness in the arms and legs. Injury to nerves in the skin increases the likelihood of injury because people cannot sense changes in pressure or temperature. So a person may sustain an injury or a burn and not even be aware of it. Foot complications in diabetes. Let's first talk about nerve damage in the feet. Nerve damage to the feet will affect sensation so that pain may not be felt. Because of this, injury may go undetected. The injury may need to penetrate all the way through the skin before any pain is felt. When an injury penetrates all the way through the skin, there's a risk of bone infection or osteomyelitis, and this increases the chances of amputations. Changes in sensation can also affect the walking pattern and also the manner in which the feet bear weight. This causes calluses to develop, which increase the risk of skin breakdown, cracks in the skin, possibly leading to ulcers. Poor circulation in the feet, another complication of diabetes. Diabetes can also result in poor blood circulation in the feet, and this makes ulcers more likely to form and slower to heal. Also recall, diabetes also impairs your ability to fight off infections, so ulcers in the feet can become easily infected. And now, because the person may also have nerve damage, the person may not feel pain because of the infection until it becomes very serious and difficult to treat, and once again leading to gangrene and possible amputations. Complications involving sexual function. In both men and women, there can be decreased sexual desire. In men, there can be erectile dysfunction, and in women, there can be vaginal dryness and painful intercourse. So, how can you prevent or reduce the chances of diabetic complications occurring? There are certain measures you can take to prevent, delay, or minimize the severity of diabetic complications. Foot examinations. Foot examinations can be done to test the sensation and signs of poor circulation, such as hair loss in the legs and foot ulcers. Also do dilated eye exams. Dilated eye exams can be used to check for the presence of cataracts and diabetic eye damage or diabetic retinopathy. Get blood tests done to check your hemoglobin levels and kidney function. Note that impaired kidney function can ultimately lead to low blood count or anemia. Urine tests to check for protein spillage into the urine. So note that when you have kidney injury, protein tends to spill into the urine, and you can test for this protein. Blood tests to perform a lipid profile. So the lipid profile is a blood test to check for cholesterol and triglyceride levels in the blood. If your values are elevated, lifestyle changes and medication can be recommended. ECG to check for any early heart issues. Note that any abnormalities in the ECG may warrant further testing, like the stress ECG or an echocardiogram. Keep your blood pressure in check. So high blood pressure combined with elevated cholesterol can add to the complications of diabetes. So ensure your pressure and cholesterol are properly controlled.
Call us today or WhatsApp your medical records to us at 747-5297 or 308-3370.
You can tap the description below for all of our contact information.